These are pictures nobody wanted to see. In Bavaria, Germany, COVID-19 patients are being transferred from one hospital to others because there's not enough capacity to treat them. Beds in intensive care units are getting sparse. For us, the situation is very tense. All the beds are full. We're still trying to take care of the urgent cases as best we can. Germany's infection rate has risen to its highest level since the start of the pandemic, while vaccination rates are at almost 70% of the population. The country that so far has done relatively better than its neighbors in dealing with COVID-19 is losing control. What went wrong? Welcome to our COVID-19 special. I'm Monica Jones in Berlin. Good to have you with us. 30,643. That's how many new cases are reported in Germany in the last 24 hours, pushing the infection rate to a new record high of over 386. And with no sign that the exponential growth could weaken anytime soon, this week we want to put the spotlight on Germany's pandemic response and its shocking transformation from role model to problem case.
It was a huge shock when 16 residents at this care facility for the elderly in Brandenburg died from COVID-19, despite having been fully vaccinated. The case made headlines nationwide because about half of the facility's staff had not had the jab.
It naturally made everyone very sad to hear that it came from the nursing staff. Of course, once again, it makes you aware that old people in particular are dependent on care workers.
Germany is currently discussing making vaccination compulsory, and not only for nursing staff.
I work in the field of medicine and I can't understand when people with medical training are opposed to it. It's incomprehensible to me.
They are in constant contact with the outside world, and they could carry the infection into the home with them, without wanting to and without knowing it.
Vaccination rates across Germany are well below target. But even if people want to be vaccinated, it's often difficult to make an appointment. Here in Bernau, north of Berlin, there is a pop-up vaccination center once a week in the town hall. People queue for hours to get vaccinated. Most want a booster shot.
It's annoying that vaccination centers were shut down just over a month ago. Then, shortly afterwards, they announced that they wanted to vaccinate several million people within a short space of time. It's annoying, but we'll still do everything we can to vaccinate as many people as possible. But that will only work hand in hand with local doctors.
Some doctors have stopped offering the jab. The government has increased the fee a doctor gets for administering the vaccine to take the pressure off vaccination centers.
The vaccination drive is a disaster. We've been standing here for over an hour and we still have a long way to go. It's very difficult to get an appointment here. It really makes you angry.
Many local politicians are also angry. They're having to deal with vaccination chaos on their doorsteps. Unlike in many other countries, Germany has plenty of vaccines to go around. Just too few people who are vaccinated to stop a fourth wave.
And for more on this topic, let's bring in Hajo Seep. He's a professor of epidemiology and he joins us in Bremen. Good to have you with us, Professor Seep. First of all, what's your assessment of the situation in Germany? How serious is it from an epidemiologist's point of view?
No, it's really very serious because we have a steep rise in cases. We have a steep rise in cases also in the hospital, in the intensive care units, and there's a little sign of this increase stopping at this point in time. So, I mean, we are looking into really a very tough winter now.
Well, that we hear a lot also from politicians, German politicians, but also keep talking about we have to break the fourth wave. Is that still possible?
It's, I mean, the waves always await at some time, so we will at some stage see the case numbers decline, even naturally, but really actively breaking is very tough. We have to do a lot of things now in any case, but that will only very slowly break this wave, if we may call it so. The case numbers will go down, but it will take time.
When we say we have to do a lot of things, apart from increasing the vaccination rate, what else can we do? What else must we do now?
Yeah, it's clearly so that this issue of reducing contacts, again, is on the agenda very much so. It may be called lockdown, it may be called whatever you want, but it's simply so that, I mean, contacts are the main game that we really have to stop playing right now. We have to reduce the contacts substantially now, because that works. We also have to obviously use again those rules of mask wearing and so on much more strictly than we have been. But the contact issue is really the main thing, especially in those areas where we have these very high, incidence numbers that we've been seeing in particularly in southern and southeast Germany. This is important and has to be done now.
And of course, it's interesting to see that countries like Italy or Spain that were really, really badly hit during the second wave of this pandemic are now doing so much better because they have a much higher vaccination rate. How big a difference would it have made for Germany, for our situation now, if more people got vaccinated?
Well, vaccination is certainly one of the main players, or even the main issue really now. But it's really so that you have to have really very high vaccination rates. So only vaccination rate is not entirely sufficient. We see in countries like the Netherlands and others that have really good vaccination rates, above 80%, but they still have problems. So you need to still keep, a clear head in terms of, being careful and not opening up everything. Otherwise, you do run into problems. So high vaccination rate important, and we have to strive for it, but also be careful with the measures, especially in this colder winter times, is very important.
Of course, we very often see a very tricky combination of people refusing to get vaccinated. There are also the same people who refuse to wear a mask or to keep a distance. What needs to be done to convince them otherwise?
Yes, I mean, there's still quite a number of people who have these misconceptions about what's going on, that they are sort of too healthy to get affected by this, that that there may be things that they don't really believe are true and so forth. So there's still some work to be done to inform people very well, also about the non-existing risks of the vaccinations, which they sometimes think they are still out there, like long-term effects of vaccinations and so forth. But one also has to acknowledge that there is a certain minority that will not be reached by any further information. That is also clear, but this may not be the majority of those who are not, haven't got the vaccination. So there's still work to be done to get those people to get vaccinated. And for others, then this discussion is up there of compulsory vaccination in the midterm.
Right, and that discussion, of course, is going on. Now, as an epidemiologist, you also keep an eye on what happens in other parts of the world. Is this what we're seeing right now a German problem? Because we see similar reluctance to get vaccinated in Austria, German-speaking, in German-speaking Switzerland, and, of course, here in our own country.
Yeah, it's certainly not only Germany, and there are even countries where there is a much more trouble in terms of getting people, convinced to get vaccinated in some countries in Eastern Europe and so forth. But I mean, you mentioned the German-speaking countries. It seems like there's a certain, percentage of the population that just have a very strong sort of idea of their liberal approach to things, that they don't want to get under pressure. And if the state says, or authorities say get vaccinated, that's the reflex is to say no, I don't want, and I will not choose that.
Okay.
That's happening, I think, in most of these countries.
Okay. Well, Professor Hayut-Seep, epidemiologist in Bremen, thank you so much.
Cheers. Welcome.
Still undecided about taking that vaccine? Well, here's Derek Williams with another viewer question.
I read an article implying that infections can run high regardless of vaccination levels in a population. Can you explain that?
My guess is the article that you're talking about referred at some point to a study submitted by a Harvard researcher that was published back in September, in the European Journal of Epidemiology. Its title is quite striking. Increases in COVID-19 are unrelated to levels of vaccination across 68 countries and 2,947 counties in the United States, which of course makes it sound like the paper is claiming that vaccines are having no effect on the course of the pandemic. Anti-vax figures and websites rushed to use it to push their agendas, and it caused something of an uproar. The thing is, experts say that any claims the study shows vaccines are useless fail to take a lot of key factors into account. A big problem, they say, is that even though at first glance vaccine coverage numbers and numbers of infections look like they should be directly correlated, it's a lot more complicated than that beneath the surface. Any attempt to establish a correlation or a lack of it has to consider what are called confounding effects. Those are factors that, if they aren't taken into account, can twist or distort epidemiological results. There are many of them that can influence evaluations like this that weren't taken into account at all in this paper. A big one is that even in highly vaccinated societies, significant numbers of people remain unvaccinated. It's pretty complicated stuff, and you can spend hours on it, but maybe it's enough to know that the lead author has since said that attempts to use his report to imply that vaccines are useless are misleading and inaccurate.